Hi, my name is Kelly Mayer, and I'm going to discuss with you during this PowerPoint both the Institute of Medicine and the Institute for Healthcare Improvement. And the Institute of Medicine is now also known as the National Academy of Medicines. So I will be discussing both the IOM and the IHI. My goals are to paint a picture of how both of these prestigious institutions began, and I will explain the roles they have had in making significant changes in healthcare. A quote I've pulled out from the Institute of Medicine is that we are all prone to err as humans, but we are also capable to make changes to prevent errors because we are human. I will first discuss the Iom Institute of Medicine. It was established in 1970. Its mission is to advise the nation on matters of health and medicine. It's an independent, nonprofit organization which actually works outside of the government to provide an unbiased and authoritative advice to decision makers and the public. So it really works to improve health through shared knowledge. It was established in 1970, but actually originates from the health arm of the National Academy of Sciences. And regarding this Academy of Sciences, as I stated, in July of 2015, the IOM actually changed its name to the National Academy of Medicine, but still publishes on health and medicine under the name IOM. The name change was part of a broader internal reorganization. Fun fact is that President Abraham Lincoln originally chartered the National Academy of Sciences. If you are asked to be a part of the IOM, you know that many of the studies it undertakes are specific mandates by Congress. Otherwise, they're requested by federal agencies and independent organizations. Committees who conduct these studies are carefully composed to ensure the prerequisite that they're avoiding any type of conflict of interest. And these leading national and international scientists are all volunteers. They are involved with IOM for the pursuit of knowledge and truth. And before any report is even released, a second group of experts complete a peer review of the body of work, and they're anonymous to the authoring committee. This type of intense reviewing has been ongoing for the last 40 years. The IOM is made up of over 2,000 individuals, members and non-members who volunteer their time and knowledge, expertise to work with the IOM. Membership is offered to just 65 people a year. If you're asked to join, it's like getting the Holy Grail. Of course, Dr. Don Berwick is a founding member. And like I said, only 65 people a year are asked to join, and it's considered the height of professional achievement and commitment to service. You're drawn from a range of healthcare professionals in the natural, social, and behavioral sciences, and also fields of law, economics, engineering, and the humanities all make up the IOM. The IOM is also home to several fellowship programs, which are managed by the Robert Wood Johnson Foundation. That's a name you might have heard when listening to possibly PBS. Huge donor is this foundation. Important work from the IOM is prevention, health promotion and strengthening, and public health practice. So you probably have really heard of the IOM through the book or the report To Err is Human. This came out in 1999, and it was groundbreaking. The committee believed it could not address overall quality of care without first recognizing and addressing patient safety. The emphasis shouldn't be on blaming, but on the safety of care, and well-designed processes of care prevent, recognize, and quickly recover from errors so that patients are not harmed. Following up from To Err is Human came Crossing the Quality Chasm in 2000. This called for urgent fundamental change to close the quality gap. It was a sweeping redesign of American healthcare systems with 10 rules to guide patient relationships and suggested organized framework. The IOM put forth the most influential framework, which consisted of 6 aims of healthcare, and this has guided the public and private sectors. The 6 domains of quality healthcare encompass safe, effective, patient-centered, timely, efficient, and equitable care. So regarding the IOM and its contributions to healthcare, they are so numerous to mention. But even recent reports that they have recently released go over the vaccinations for children and timeframes that they're done in, and if that's appropriate. That's another recent one. Diabetic medications and the efficacy of dosages that are prescribed at this time, and then also just improving patient and primary health care relationships. Those are just some recent ones. But the IOM is significant contributions of healthcare, as you can only imagine, especially with To Err is Human and the other quality chasm. Next, I'd like to speak about the Institute for Healthcare Improvement, the IHI. Their vision is that everyone has the best care and health possible, and their mission is to improve health and care worldwide. Once again, Dr. Don Berwick is a founding member. It was founded in 1991 as part of the National Demonstration Project on Quality Improvement in Healthcare. And Dr. Berwick and a group of visionary individuals committed to redesigning the healthcare system without error, waste, delay, and unsustainable costs was kind of a big bottom line for them. The IHI uses the science of improvement through the PDSA model, Plan, Do, Study, and Act. When they first started, their first decade, they focused on identification and subsequent spread of best practices by pointing out defects and errors, specifically in the ED and ICU. The second decade that this institution was evolving, they established a defining focus on innovation and bold creation of new solutions to old problems. This was shown about in the manifestation of the 100,000 Lives campaign and the 5 Million Lives campaign, spreading best practices and changes to thousands of U.S. hospitals. And then the third decade is when the triple aim came about. And this encompassed the helping with the shaping, involving, assisting with the health of the population, the experience of the care, and the cost per capita. So this triple aim, all this entails an ambitious improvement of all levels of care. It's improving the patient experience, improving the health of the population, and reducing the per capita cost of healthcare. And why this come about is because Centers for Medicaid and Medicare Services were looking at how the U.S. healthcare system is so costly in the world, accounting for 17% of the gross domestic product. And then it was considered to estimate percentage growth to nearly 20% by 2020. At the same time, countries with health systems that outperform U.S. are also under pressure to derive greater value for their resources devoted to the healthcare system. This then lauded the design of the triple aim enterprise. This was focusing on individuals and families and redesigning primary care services and structures, population health management, cost control platform, system integration, and execution. And this again is just kind of a snapshot about that. So looking at what the IHI has done in the way of healthcare improvement with their triple aim and using the PDSA model, again, just like the IOM, the amount of changes that they've incorporated through healthcare can be seen through the improvement in maternal and infant health around the world, improving diabetic care, designing human-centered care, and integrating behavioral health, training primary care physicians to become more community-centered, improving data. These are just a few of the hundreds and hundreds of things that the IHI has assisted with improving our healthcare. So I hope this shows a snapshot of both the IHI and IOM and gives you a little bit of a better understanding of where they came from and where they've evolved and what they've done to assist us with our healthcare and our daily lives. So I appreciate you viewing my video, and these are my references, and have a good evening. Thank you.